Hello, everyone. This video will discuss the mid-range theory of patient advocacy. I will cover how the patient advocacy theory addresses the four meta paradigms of nursing and how the theory fits well within the practice setting as a pediatric care coordinator. In addition, I will also give a couple of examples of the concepts from the theory that could directly influence patient care in my setting. But first, let's start by explaining the mid-range theory of patient advocacy. This theory is viewed as a process or strategy involving specific actions of the nurse to protect, represent, and support patient rights, best interests, and values in the healthcare system. There are three core attributes included in patient advocacy. The first core attribute is safeguarding patients' autonomy. The second is acting on behalf of the patients. And the third attribute is championing social justice in the provision of healthcare. Moving on to the four meta paradigms of nursing. This includes person, environment, health, and nursing. Person in this theory refers to the patient, their family, and their support system. It recognizes that kids are a vulnerable population because they rely on adults to make decisions for them. But the reality is that not every guardian always acts in the best interest of the child, whether it's due to neglect or lack of knowledge. That's where advocacy comes in. This theory pushes nurses to step up and ensure kids get the care they need when their guardians aren't able to. The environment includes the social and economic factors that impact a patient's health care. This theory explains that the environment is made up of both macrosocial and microsocial factors. Macrosocial factors include things like health disparities among different populations, hospital policies, and even broader issues like healthcare laws and access to resources. On a smaller scale, microsocial factors focus on the patient's immediate surroundings, things like their interactions with healthcare providers, family support, and community resources. Next is health. In this theory, health isn't just about not being sick, it's about overall well-being, including physical, emotional, and social health. Patient advocacy is all about making sure kids get the care they need without unnecessary barriers getting in the way. Advocacy plays a significant role in keeping kids healthy and ensuring they get the best care possible. Nursing. This theory is all about the nurse's role as an advocate, but it also recognizes that advocacy comes with both positives and challenges. On the positive side, advocacy helps ensure that children get the care they need, even when they or their families can't always speak up for themselves. It allows nurses to push for better resources and improve communication between providers. But advocacy isn't always easy. There can be resistance from healthcare systems, conflicts with guardians or providers, and emotional challenges when fighting for what's best for the child. Even with these challenges, this theory reinforces that advocacy is a key part of nursing, and it is our responsibility to navigate these barriers to make sure our patients are truly supported. Next up, I will discuss how the theory fits well within my practice setting as a pediatric care coordinator. The theory of patient advocacy fits perfectly within my role as a pediatric care coordinator because advocacy is central to what we do, especially when working as a liaison between schools and the medical world. We can assist the families in getting a diagnosis and even provide medical records to the school. Many children face barriers to accessing health care. We advocate for the patients and their guardians by helping to decrease these barriers. We do this by setting the students up with mental health providers, assessing and assisting with social determinants of health, providing transportation, and attempting to remove any other barrier that stands in the child's way of getting the best health outcomes. My job is to ensure these kids receive the care they need by coordinating with families, schools, and healthcare providers through advocacy. Now I will go over two specific examples of how the mid-range theory of patient advocacy directly impacts patient care in my role as a pediatric care coordinator. The first example of how this theory impacts patient care is how I advocate for the student's mental health. One of the first things I do when I get on the phone to speak with a guardian is allow them to express their concerns for the student. During this process, I am advocating not only for the child, but also for the caregiver by providing emotional support. Listening does go a long way. This helps to build a rapport with the caregiver, and then they are more receptive to the recommendations I have for them. Another way this theory impacts patient care is through our work in the community. A lot of the kids in our program come from low-income families, which makes it harder for them to access basic health care. As part of our advocacy efforts, we help bring those services to them by offering sports physicals, vision and hearing screenings, and even dental varnishings for some of the younger kids. By doing this, we help remove barriers like transportation and cost, making sure they still get the care they need. This concludes the video. Thanks for watching.